In 1932, the US Public Health Service, working with the Tuskegee Institute, began a study of the effects of syphilis on the human body. The government officials recruited African Americans in the study by offering free medical care to them. The men recruited were mostly poor sharecroppers from McCann County, Alabama. They were also given free meals and burial insurance. The study involved around 600 volunteers, with 399 with syphilis and 201 who did not have the disease at the time. I would also like to point out that Tuskegee wasn't the first unethical syphilis study in the US. The US conducted experiments in Guatemala decades earlier between 1946 and 1948, where nearly 700 men, women, prisoners and soldiers were intentionally infected with syphilis. Now, the men enrolled in the Tuskegee experiment were never told they had syphilis. Instead, researchers kept this information from them and told patients that they were being treated for bad blood, a local term used to describe several ailments including syphilis, amnesia and fatigue. They were never given the proper treatment needed to cure the disease. Doctors were also interested in whether the disease affected whites and blacks differently. The issue of racism during this time was evident, as some doctors believed that African Americans were more prone to syphilis. Even when penicillin came into use in 1947, those infected were not given the treatment. Each time the participant went to the doctors thinking that they were going to be treated, and instead the doctors and the nurses were giving them these fake placebo medicine that didn't do anything for these participants. Now, the initial project was supposed to be conducted for 6 months, and instead the study went on for another 40 years. The entire time, the participant thinking that they were going to be treated. When the story finally broke by the Washington Star on July the 25th, 1972, it was estimated that around 28 men had died and a further 100 had died of complications, and at least 40 wives had contracted the disease, and a further 19 children had contracted the disease at birth. In 1974, a $10 million out-of-court settlement was reached. This resulted that around $37,000 was to be given to each survivors. As part of the settlement, the US government promised to give a lifetime medical benefits and burial services to all living participants. In 1975, the wives and widows of the offspring were added to the program. In 1995, the program was expanded to include health as well as medical benefits. It wasn't until May 1997 that the US government acknowledged its wrongdoing during the experiments. The Tuskegee experiment would not have been possible without the help of nurse Eunice Rivers, who worked for the Tuskegee Institute. As part of the school, she provided various public health service for African American men and women in rural Alabama. She became a well-trusted and well-respected member of the community. Rivers became one of the first African Americans to be employed by the United States Public Health Service, thus paving the way for other people of color in the area of service. However, her role in the Tuskegee experiment took a dark turn, as her role in recruiting African Americans for the next 40 years would cast a dark shadow on her career, as she was aware of what was happening to these participants. However, she kept silent and encouraged those to stay on the program. Once the news of the unethical experiment was exposed back in 1972, Rivers retreated into silence. For some, she was viewed as a committed nurse. To others, she was seen as a race traitor who used her education and class and power to keep her job and sell out those that she was supposedly looking out for. There are stories of how Nurse Rivers would go to the funerals of those who had died, and she would request the widows to have an autopsy conducted on their husbands to see the impact of what syphilis had done. Particularly, the heart and the brain was a key focus for a lot of the doctors. Now, regardless of what you think of Nurse Rivers, we can't place the blame just solely on her. The government, the federal government in particular, should take the majority of the blame. Experiments on African American is nothing new. In the past, during the 19th century, physician James Sims developed tools and surgical techniques relating to women's reproductive health. He is also credited as the father of modern-day gynecology. His research was conducted predominantly on enslaved African American women, and he was famously credited for not using anesthesia during these experiments. Now, individuals like Sims were celebrated so much so that there was a statue of him in Central Park, and only recently was that statue removed as a result of the movement of Black Lives Matter. And in fact, there are some doctors who feel that African Americans or black people don't feel pain the same way as white people do. Now, it's ignorance like this from medical professionals that results in the lack of treatment that African Americans receive compared to white counterparts. But this is all I've got to say on this topic. I find it really interesting. But if you've got any comments, please leave them down below in the comment section. Thank you for watching.